Hello. My name is Katie Zorns, and I want to be a gerontological social worker. Gerontological social workers, their responsibilities are to coordinate the care of elderly patients in a wide variety of settings. These settings can be hospitals, community health clinics, long-term and residential healthcare facilities, hospice settings, and outpatient and daytime healthcare centers. There are different responsibilities between outpatient and inpatient settings. In outpatient settings, they serve as advocates for the elderly individuals, and they connect elderly individuals to resources in the community that can provide additional support. In inpatient settings and residential care settings, they conduct intake assessments, they collaborate with a large team of hospital staff to develop and regularly update patient treatment plans. They discuss treatment plans with patients and their families, and they manage patient discharges. So those are the responsibilities of a gerontological social worker. The required education is a master's in social work, but social work is a field that has a lot of variability. So something that's helpful in preparing oneself is to get internships in healthcare social work, taking courses related to healthcare social work, reading books about healthcare social work, talking to the elderly in your family about their problems, and volunteer work with the elderly population. My education is I am currently in a psych major, but I am taking the required classes to be able to apply for the social work program at BYUI. By fall 2021, I will have finished those required classes and have applied to the social work program. By spring 2023, I plan to graduate in social work and then apply to a graduate school to complete my master's. Why did I choose social work, and more specifically gerontological social work? I want to help people with mental health problems. That was the original desire. I'm a flexible person though, and I like a lot of variety. Through doing research, I realized that social work has more flexibility and variety, and that you can sort of switch around within the field, and I really like that. I chose gerontological social work because I enjoy working with the elderly, and because they are elderly, and you're helping them adjust to age. You end up getting to know your clients for a longer period of time. And social workers are able to be more personal with their clients and get to know them well. And this is something I desire because I realize that I really like that, getting to know people well. And my decision for social work in chapter 13, after reading chapter 13, I realized I do have a desire to help people. I am interested in helping people cope in their environment and make changes in their lives. And I'm interested in working with clients and their families. And this was all stated in chapter 13 under specific things that social workers may enjoy. And that, like, sort of signs that you should switch from psychology to social work. So that's why, in general, I want to be a social worker, and specifically why I want to be a gerontological social worker. Thank you so much for listening to my presentation.